At Dental TI, every installation begins with careful planning and thoughtful collaboration. For Luxia Dental, we worked closely with our client to choose the optimal location for their new CBCT system. By positioning the unit in the right corner of the back wall, we allowed direct patient entry and convenient operation. The PC monitor fits neatly into a recessed area. Once the plan was in place, we meticulously unpacked and staged each component of the CBCT system. Precise leveling is critical to ensuring accurate geometry in diagnostic scans. This unit leveled perfectly, reflecting the high standards we uphold for every installation. We also drilled discrete holes in the flooring behind the unit's column to route low voltage and power cables beneath the floor, achieving a clean, virtually cordless appearance. The heart of the CBCT system, the C-arm housing the tube head and sensors, was installed with precision and care. This is the most sensitive and costly component, and our team ensured its secure and precise mounting. To further enhance cleanliness and usability, we concealed the capture box and network switch neatly within an access panel beneath the monitor. The system's accessories, including chin rests and comprehensive manuals, were thoughtfully organized for easy client access and maintenance. The result? A sleek, professional, and highly functional CBCT installation that exceeds expectations. Luxia Dental now enjoys an efficient, visually appealing setup designed with both patients and practitioners in mind.